just waiting for a few. Welcome, everyone. I'm just waiting for a few participants, including one of our presenters. But welcome to everyone who's here now. And if you would like to, please feel free to introduce yourselves in the chat and what organization you're from. I'll give everyone a couple of minutes. I think I'm going to get started. We've got such a full agenda. It's lovely seeing remotely everyone saying hello in the chat. So welcome, everyone. My name is Elizabeth Girdwood, and I have the pleasure of facilitating today's webinar. There's a whole team behind me, and over the next few months, you'll be meeting them as we all share this facilitator role. But we're excited at Data Drive 2030 to introduce this new ELOM webinar series for 2025, ELOM in Practice. And this is our inaugural session. This series is a response to the request made at our in-person community of practice held with ELOM users in October last year to make the touch points for ELOM users more frequent this year. So approximately every 6 weeks, we hope to gather online as a community to hear from colleagues who've completed ELOM studies. And our objectives are relatively simple. We want to provide a forum for users to learn from other studies and to share their findings with the sector. So we welcome you, all of you today, and we look forward to hearing your voices in this collegial setting. It's not as good as an in-person natter, but let's make it excellent all the same. We plan to give each webinar a distinct theme to focus the discussion. So for example, today we look at the experiences of a couple of organizations who've recently completed pre-post child outcome studies. These are studies that have assessed children on the ELOM 4 and 5 at 2 points in the calendar year. After that, we'll dive deeply into the experiences of first-time users of the ELOM tools, those working with the Learning Program Quality Assessment Tool, the LPQA, those with ELOM data already embedded in their annual M&E reporting, and those who've commissioned large evaluations using ELOM tools. We'd be so interested in your input as we design the series. It aims to be as useful as possible, so let us know what you need and what you'd like to hear more of. This is our first webinar in the series, so it's on the topic measuring developmental change. So we're delighted Modupi Mazibuko from Penreach and Julie Hay from Singakwenza have agreed to present and discuss their studies with us all. We look forward to hearing more about the reasoning behind their pre-post studies, where their challenges lay, and how their findings have shaped their programs moving forward. We're going to use a fairly standard format across every webinar. The 2 or 3 presentations will aim to take around 10 minutes each. We'll then have a 10-minute discussion around each one's findings and experiences, and then we'll open the floor for questions for the final 20-25 minutes. But before we dive in, let me start with some housekeeping. Because this is our first webinar in the series, we'd appreciate any feedback on the Google form at the end of the webinar. I think Jess has posted a link to this in the chat already, but we'd be very grateful for that. As you can see, we're recording the session. I hope you're all happy with that. Everyone should please keep their microphones and cameras off to avoid interruptions. That said, we'll be answering questions at the end of both presentations, so please post your questions in the meeting chat, and then I'll ask you to unmute yourself and ask your question directly when the time comes. Now, I'd like to introduce you to the speakers and their respective organizations. Julie Hay is founder and director of Singakwenza, based in the Midlands of KwaZulu-Natal. Singakwenza trains practitioners, parents, and caregivers to provide fun, educational activities that enable young children to develop through play the foundational skills for learning. And this is supported by resources made solely from recycling. Modupi Mazibuko is program manager of Penreach's continuous professional development and based in Mpumalanga. Penreach is an NGO and social impact organization working towards educational excellence in disadvantaged rural communities in 5 different provinces. And it was established in 1991 and is known for its local knowledge and expertise at grassroots level. So we're absolutely delighted that they've agreed to present today. And without further ado, I think over to you, Julie.
Unmute us. Hi, everybody. So my name is Julie Hay. I'm the founder and director of Singakwenza, and my colleague here, Jade, is our occupational therapist. So we're going to share the presentation today and just share a little bit about what Singakwenza does and then how we've used the ELOM and the results that we've had. So I'm hoping that you will be able to see the screen. I'm just making sure that we can share. Beginning. Okay, just checking that you can see us, Elizabeth. You can see the screen. Perfect. Okay, so Singakwenza, we, as Elizabeth was saying, we're an early childhood education program specializing in educating practitioners at a very grassroots level. We've got branches in Pietermaritzburg and Johannesburg. We're working with 26 creches at the moment in Pietermaritzburg and 8 in Joburg. We have 9 trainers, and they go into these grassroots creches and mentor the practitioners for a 2-year period. So we go 1 day a week, every week for a period of 2 years. And what we're trying to make sure is that by the time we have finished with the training, the practitioners are able to run a program that develops the foundational skills that are needed to prepare children to thrive in formal education. So our process is about training practitioners and then test that program. So we focus on gross and fine motor skills, pre-literacy and pre-numeracy skills, and the whole program is play-based. And as Elizabeth mentioned, everything we make is made using household packaging that's usually thrown away. So as you can see behind us, we have got our yogurt containers and our lids and all the materials that we use in our program. And it makes access for all children to play materials that can develop them holistically. So one of the things that we found with our program was that we had quite a lot of qualitative data that was coming back that showed us that we were doing a good job in our program, but there was no quantitative data. And for many people, particularly funders, that was really important. We wanted to measure and understand our impact. So measurement is always a challenge in an NGO. And Jade will chat more about how we were trying to do it before. We also wanted to make sure that we were optimizing our resource allocation because we wanted to make sure that we are doing it holistically. One of the things that has been a big focus on our program is that holistic development. So it's not a schoolification program. It is focusing on developing the child holistically and every child holistically to the best of their abilities before they start school. Obviously, we wanted the measurement to strengthen our grant applications, and then we wanted to show our current funders that they actually are investing in a decent program. So again, focusing on long-term sustainability. Jane, you can take over. Yeah.
So our previous monitoring and evaluation measures, we had OTs organized in the program before. And so we looked at trying to use OT-based assessments Unfortunately, one of the challenges with these assessments is that they are Eurocentric, so they were designed in Europe and America. And so we find that the samples were so different to the samples that we have in our program. There was, of course, a language barrier because our OT Zulu was very limited, and so there was a translator involved, and valuable information of assessments could have got lost. Again, the samples that these tests would have been based on would have big socioeconomic differences, which would alter our results. We definitely found we had a lack of local norms to rely our assessment findings on. Even the developmental milestones would be different in these different socioeconomic sample groups. And as a result, we found that we had validity and reliability difficulties, and they were difficult to compare as a result. So that's when one of our OTs was networking and found out about ELOM, and we were delighted because of all of the positives they had in terms of just being South African based and relying on samples that were from our context. And so we decided to invest in our trainers. So our ECD trainers became qualified. So we really believed in ELOM and decided to get behind it. So we invested in we currently have 4 assessors that are also our ECD trainers. And we dived into doing an in-depth case study. That was our first study. And we included creches that had graduated from our program and current creches. And then, as Elizabeth said, we did the pre and post data collection. So we assessed our children in February as they arrived into the creches, and then we assessed them again in the 4th term in October. One of the things that was brought to our attention, although we definitely did look at our registers each term, is that ELOM brought to our attention that there was a significant dropout rate between our baseline and end line. And we noticed that absenteeism was very prevalent during the 3rd term, so and most notably during July and August. And we also further noted that if children had not been present for much of the school year, then they were excluded as well because we couldn't guarantee that they'd had enough of our program. And so that's really highlighted the impact of attendance in early intervention in your ECD centres. So from our first study, we had feedback that one of our domains was significantly lower than the others, and we had focused on fine motor. So we knew then that our needed some development, and this was very helpful from ELOM to receive these results. And so we engaged in our own pilot study. So internally, our OTs went and assessed children using a VMI-based assessment, and then we designed weekly VMI-based activities, and we implemented these over a 5-month period. And we noted that we had quite a big improvement in VMI as well as their visual perceptual scores. And you can see this little picture on the side. So when we first assessed, you could see the score was below the age, and after 5 months, their scores were significantly. So they were 4 years and 7 months. This is just the DAP, which is a draw a person assessment. And you can see after our intervention, we had a notable, they were now scoring above their age. So we were excited to then implement this. And so these are a couple of the activities you can see, all of them focused on developing the visual and motor integration skills specifically. So looking at visual perceptual, as well as almost your hand-eye coordination.
And all made using recycling.
Oh, yes, all made using. So this was actually very exciting to try and create toys that were problem-based, problem-solving and independent learning so that the children could engage. And then these are just a couple of the activities that you can see the children really engaging. You can see the motor component that they would then have to adjust and get the feedback from their participation in these activities. So great that we could then see that VMI specifically was something we needed to work on, not just fine motor. So luckily it incorporated fine motor as well. And these are some of the results that we received. So our 2024 results, we saw a great improvement in this domain. So just over 20% of our children were on track for baseline in the fine motor and visual motor integration. And now it's one of our highest achieving domains. And this was only from 6 months of VMI activities incorporated into the formal lesson plans, because we were busy doing our pilot study and busy getting our activities ready. So we're so excited to see this, this improvement. We decided to give our practitioners this feedback in a workshop so that they could see the impact of the activities that they were doing and of the program itself. We also printed out a few of the graphs from our ELOM reports, which were very helpful. And then our director, Julie, she recreated the graph like you saw on the previous page that we then shared on LinkedIn, our social media, and donor reports, as well as with our volunteers, because they're a vital part of our program. So why are we testing again? We love the ELOM process, and we are having a change in our catchment area. And so we really want to use ELOM again to be able to understand where our children are starting from. And we now have creches that are in quintile 1, whereas previously all our schools were close to quintile 3 based schools. So it's going to be very interesting to see where they start again. We want to see the impact of our dosage. So we have weekly mentorship, and then creches that are far from our catchment area, we see fortnightly mentorship happening. So we'd love to see the difference between this. And then we are also wanting to shape the program and adjust just like we did with our VMI. So that's why we love ELOM, and we love to engage in this process pre and post to be able to monitor the developments.
Thank you so much.
Thank you, Julie and Jade. It was very exciting to see these results last year. We were thrilled. I want to say Toby Runciman has got a question for you. I wondered, Toby, if you could unmute and ask it directly of Judy and Jade.
Hi, guys. Hi, Liz. So, yeah, just my question, that was a nice, impressive graph. Do we know what the sample size was just behind those percentages? Thanks.
Yes, so we work with approximately 1,000 children, and we managed to get just under 100 children in our sample size. So it was slightly less than 10% of the number of children who were being trained.
Okay, perfect. And that was a match pre and post sample, I'm assuming. Yeah. Okay.
Yeah.
Thanks.
So one of the challenges that we had was that pre and post, because we had such a big dropout. And get as many as we could in the pre, because children moved to different creches, their families moved away, some of them were absent for a large percentage of whatever. So we lost approximately 15 of our pre numbers. So we had to make sure that our post numbers had enough to give us a reasonable sample size.
Okay. Don't feel bad. That happens to everyone all the time. So.
Thanks, Toby.
Thanks, Toby. There's another question, and I wondered if Mojtaba, if you could please unmute yourself and ask your question about the control group.
Hello, sure. Thanks for your presentation. It was quite exciting, and very well done with those recycling materials, everything. I do have a question about the control group. I wonder whether you had a control group in addition to your experimental group to see what have been the changes with no intervention, actually. So this is in a fully experimental design, we always have the control group, right? To say this is exactly the result of our intervention, not just, let's say, brain maturation over 6 months or so.
So thanks for that. It's a great question. So one of our big challenges, we wanted to do that. And in fact, I'm busy doing my master's at the moment, looking at the experiences of the practitioners of our model of mentorship training and the experiences of using the toys made from recycling. And one of the things we wanted to look at was a control group. But one of the big challenges with that is, how do we go into a creche and say, we're not going to help you this year. We're just going to measure your children and check that they actually are not going to make the progress that they should compared to the children in our program. So to create a control group is a really big challenge, and that's one of the reasons we haven't done it. So I get what you're saying, and I really understand it. But we had a very big moral issue with asking the parents to sign permission for them to be tested pre and post, knowing that we were not going to give them an intervention.
But to solve that, I totally understand that that's a legitimate answer. But we usually what we do is to make a crossover design, right? So it's like we test a control and experimental, and we check the result. If there was an improvement, we switch the intervention. So the control group will receive the intervention right after, and then the other group will serve as a control. So in that case, well, at university we do this to go, to solve that moral issue, basically.
So one of the things that we like about the ELOM as well is that obviously we are getting almost a control group from across the country, because when we look at the results of our Singakwenza results, our overall results, at the end line, it was 74% of our children are on track, and the end line for the overall for KZN is 30.2%, I think it is. Liz, you'll be able to answer that one better. But the fact is that we are comparing our program to other programs, so it almost gives us the control group, I suppose. That's yeah. There was something you want to say?
I think the wonderful thing about the ELOM report as well is that the brilliant statisticians, that's also one of the things, is we would never know how to do this, but they do take the program effect versus the maturation effect into account.
Okay.
So that's fantastic. And that in essence also would provide almost your control group, in a sense that if the children were just growing without any intervention, where would they be? And so we can see at the end, in each domain, it will tell us if we had a large, medium, or small program effect. And most of ours were large to medium impact, which is great to see. So they give us a direct correlation between maturation effect versus program effects.
Do you know how they calculated the maturation?
No idea.
Yes,
You'll have to
it's got
those
it's on our website. There is a paper I can share with you. There is a paper about maturation effect there as well.
Excellent. Thank you so much.
Marie-Louise, I wondered if you wanted to unmute yourself. She's asking about your training program, the status of your training program. Over to you, Marie-Louise.
Thanks very much, and thanks for that good presentation. I wanted to know about your training and the qualifications of the practitioners that you're working with. Is it accredited training, or is it your own designed training that is being offered? Thanks.
So we haven't accredited our training because thank you, Marie-Louise, I appreciate your question. We haven't accredited our training because we focus on very much grassroots. So we work particularly with creches where the practitioners don't necessarily have access to formal training. So some of the practitioners that we work with have got an NQF level 4. A couple of them we have actually put through our bursary program to get an NQF level 4 through Caversham, NQF level 5 with Caversham Education Institute, so that they can be on that trajectory to be part of the cohort of being able to be employed ultimately as formal practitioners. But many of the practitioners that we work with will never get to that level where they're able to have a formal qualification, and we come in below the formal qualification level, and we work with them to try and get them to that stage where hopefully they can then take on that next step. So our program hasn't been formally accredited, but purely for the fact that most of our practitioners would not be able to submit a portfolio of evidence. Some of the educational levels of our practitioners are not necessarily ones that would cope with a formal qualification, but we didn't want to exclude them. So we come in at that level, and then we encourage them to then take their training themselves, those who can, to that next qualification level.
Thank you, Julie and Jade. I know that Magali has got a question she really wants to ask. So Magali, over to you. And then Jess has got a question. And I'm keeping a careful eye. You've got 2 minutes left.
Okay.
So those
Otherwise,
two,
we can hold them over to the next one.
No, over to you, Magali.
Thanks, Liz. Hi, Julie and Jade. Thanks so much for your interesting presentation. I was curious about, and I'm not sure if I got this right. Did you say, Jade, that you trained your practitioners to assess the children on an ongoing basis on their VMI? Or did I?
No. So
Okay.
we trained so not our practitioners, no. So we trained our ECD trainers to be ELOM assessors, which helped our fieldwork process with our baseline and endline assessment. But no, when we did I think you're referring to the pilot study so that we could check that our VMI activities were working, those assessments were done by just the OTs.
All right.
And then our trainers, they rolled out our activities with our practitioners in the creches.
Cool. Thank you.
Thank you, Jess.
That's all right, Liz. I think we're a bit behind time, so we can move on and I'll save my question for later.
Okay, thank you, Jess. Vanessa, I'm going to respond to you directly because you've got a very interesting question, which is slightly off topic for this, but still important to answer. So let me do that. Thank you both for this and for this initial interrogation. There's going to be a lot of time now for our post this for further investigation. So thank you, everyone, for questioning. Modupi, I wondered if you wanted to unmute yourself, unhide yourself, and present on Penreach's recent work.
Thank you very much, Elizabeth, and good morning, colleagues. I will just share my screen shortly now. Right. Thank you, colleagues. As mentioned, my name is Modupi Mazibuko, and I'm the ECD Program Manager at Penreach under the ECD Continuous Professional Development. So I will just jump straight into our ECD program. Our focus area, we focus on activities that are supporting children holistic development, especially in line with our mission statement that we want to increase access to children in the ECD centers, as well as in the ECD settings in the communities that we serve. So we have a lot of activities that are aimed at improving support for children through our toy library. We also have the play day activities that we arrange where we can showcase the importance of play-based learning, and also have activities that we support the ECD practitioners and center managers through training, where we offer training to support the issues around compliance, health and safety, as well as learning approaches in the ECD center. But we're also accredited as an institution for level 4 in early childhood development qualification. So we provide support through coaching and mentoring on a regular basis, where our ECD change agents provide support or continuous support to ECD centers on a weekly basis. And one of the things that we do is to capacitate centers through resources, and also we play a critical role around advocacy, where we lead communities of practice with early childhood development centers, as well as other stakeholders in the ECD sector in the province. But also we have focus activities for parents, where we engage parents through workshops, awareness events, as well as volunteerism. And in line with our model, we have ELOM as attached to our model, because we have always believed that in order to ensure quality of our program, and we have seen that ELOM is a very useful and viable tool that we have sort of incorporated in our approach, in our intervention. And all our approach are aimed at ensuring that children are ready for grade R in their development. So I would just maybe zoom into rationale for our usage of ELOM. I think that primarily because we have in the past been conducting deep studies where we've sort of measure the development of children in a very brief snapshot. But since last year, we did first the pre and post, which we believe that it was very important for us to sort of understand the support for children and also understand how we can provide better support for children. So we find that the pre and post were more useful and relevant for us to undertake that or conduct the assessment. So in terms of the pre-assessment, yes, you would see on my screen that in most of our children, they were performing below expected outcomes. And as compared to the provincial ELOM overall results, we're sitting at 65% children in the province performing at this rate. Our baseline showed that overall in all other domains that we measured, our baseline scored around just a little around under 50%. And if we zoom into these milestones, which really were sort of highlighted as risk, it's your gross motor and your fine motors that we felt that with the report, to the baseline, that highlighted that more children there's still a need for support and engaging children in ECD centers to remove them from falling behind. And in other domains, we performed relatively also less. But what is surprising and what we, when you compare the pre and post, if you look at our end line, it shows the significant improvement in terms of the developmental milestones. And that it's mainly because of us understanding the baseline results and beginning to unpack to see what are these results are telling us at the organizational level, but also at the program level, engaging with the ECD center. So our end line really shows a significant improvement in most of the domains that we measured. But however, the fine motors still remained the area of concern based on the end line results, but overall significant improvement in terms of the results. And in terms of the enhanced support that we provided for centers, we were able that after the report that we provided centers with the report internally, where we unpacked the results, as one of our colleagues in their program also mentioned that in terms of making sure that our beneficiaries and especially the centers that participated in the studies are aware of the report. So we simplified the results to their level so that they can understand what are these results telling us and what are these gaps? How can we collectively close these gaps in our approach, in our intervention? So we worked with ECD centers and enhanced our cluster workshops. We're directing to support ECD practitioners and center managers to ensure that we can close the gaps given the pre-test or the baseline that we conducted. And also we focus more effectively on ensuring that we can take some of the recommendations that were highlighted from the baseline and improve on those recommendations. And lastly, the intervention really was to make sure that what are the other resources, how do we strengthen capacity in the ECD centers through resourcing the ECD centers. So in this aspect as well, we have worked with other mind-like organizations such as Sonali Bali, the Rich Trust through the Reading Table resources where we could sort of capacitate our ECD centers and practitioners, in addition to our Penreach Essential package, which then deals primarily on the early learning intervention and focusing on improving the quality of early learning. And if we zoom into some of the lessons that we've learned, it's that in early gaps exist where we felt that it's very important that we need to make an early intervention at an early stage where we could perhaps maybe close these gaps, but also identify the gaps that exist in terms of children meeting the developmental milestones. And also the measurable impact in terms of the pre and post, it's very effective that we are able to then track their progress from the baseline to the end line. And one of the things that we've learned is that the end line and the baseline and the end line really provides a well-rounded support for children to thrive, because then it gives us an indication, as mentioned earlier, as to what the gaps are in the ECD center and how we can then mitigate and support children to ensure that our end line becomes different or becomes better given the support that we would have provided. And one of the challenges are perhaps maybe if we zoom into the challenges in terms of conducting this, the ELOM studies, the pre and post, was in our province, some of the centers are very in remote communities where it becomes a logistical challenge to sort of arrange to reach out to the ECD centers, but we find a way of making sure that we can help our assessors who are going into the communities to make sure that we can reach those far ECD centers in our communities. And as family relocate, that also affects the studies. And in our study, in our pre-study, we sampled 80 children, but towards the end line, we had over 60 children that we were able to sample. And of course, what was also mentioned by my colleagues as well, that absenteeism is one of the challenges that we saw, that some of the children we could not reach because they did not attend the center on the day of the assessment. But there's overall opportunities with regards to the end line and the post and the pre-post, the pre and the post tests, where we find that it actually expands on our MEL practices and gives us a very good picture to how we can improve our monitoring systems, and also the opportunity to work with the department in terms of also ensuring that we can delve deeper into the curriculum development in ECD centers. We have been very fortunate that we work closely with the department, and they have also been having access to we shared the results with the department as well. And also very importantly, that we currently, as I mentioned, that we play a major role in terms of advocacy, where we are currently also working with the local government through the IDP model, where we would want to ensure that the municipalities support early childhood development. And having such results, the pre and post, really gives a deeper understanding of what are the challenges exist for children to thrive. And more also in terms of supporting for the results assist us in terms of resourcing more funding, in terms of that we would have a larger sample of children that would have participated in the assessment, and the opportunity as well that we would share the results with the communities and parents in particular, so that they can understand their role as well in terms of supporting children in their communities. So yeah, I think that's all from our side. Thank you.
Thank you, Modupi. I've got lots of questions myself, but I know that there are quite a few in the chat. So let me hand over to the first one. Magali, would you like to unmute yourself and chat directly to Modupi?
Me again. Thanks, Modupi. I might have missed it because I think you spoke about it, but maybe I wasn't sure exactly if you said what I thought. So, because you said, so I understand that you've done the baseline, and what I was trying to understand is whether after the baseline you were able to really identify the specific strengths and weaknesses of different ECDs, and then tailor your intervention accordingly to try and respond to those different areas of strengths and weaknesses. And if so, how did it work? Did you find that was helpful?
Yeah, thank you, Magali, for that question. So what we did, as I mentioned, that firstly we internalized the internally we unpacked the results and understood what the implications are in terms of our intervention on the ground, and also and then we moved into the second phase where we engage with the participating ECD centers, where we sort of unpacked it in the way that they will understand what the results are saying. And we have been able to then just overall see how we can support them in terms of making sure that we can close those gaps. As I've mentioned, that we then roped in other partners that provided a significant support for enhancing the early learning in these communities. Yes, so we have been able to sort of in general just looking at the results and looking at the gaps, but perhaps maybe what opens up as a process that we would want to undertake is then zoom into each and every ECD center in terms of supporting them in the challenges that the results might have shown to us. But what we did was just to take an overall, based on the results, just take on the overall centers and walk the path with them all together.
Yeah, because the sample size don't always allow you to have really conclusions at ECD center level, I suppose. Okay. Yeah, thanks.
All right, thank you.
Thanks, Magali. Jessica, I know you've got a question.
Thanks, Liz. Thanks, Modupi. I'm interested to know how you have or plan to share these results with parents and communities, because I know, pre-post study like this speaks to the effectiveness of ECD centers. And is there any sensitivity around sharing that information with parents?
Yeah, thank you, Jess. So we have parental sessions or parental program that we run where we support parents that are closer to the ECD centers in the various communities. So we are planning, or we have in those sessions hosted or been able to share the results with the parents. But in the way that we share, we obviously make draft it in a way that it makes sense to them, not in a very high level, but more detailed, and making sure that they could understand the impact of these gaps that exist that we identified. So we through our parental component, is we are able to share, but then bring it closer to the parents, so that they can be able to take lessons and learnings from there that they can be able to implement in their respective household.
Thanks, Modupi. I'd like to open the floor to questions for everyone. So both Penreach and Singakwenza, but essentially both of you, I've got a question myself to start, because essentially both of you speak about the dissemination of the findings. I mean, Jess has spoken now about the sharing with caregivers and parents. You speak about sharing at the IDP level or other kind of regional stakeholders, and then also like communicating with ELPs directly. How do you tackle sharing difficult findings? What is the experience there that you could share when the results aren't great, when the results are difficult? How are those conversations? How do you navigate those?
I think because we've got such a good relationship with our practitioners, we are mentoring them for 2 years. It's much easier to give results that maybe aren't so positive because we are with them in it still. So we give feedback. For example, I think some of our girls were not as strong as our boys. And so we would give information and share strategy on how to deal with going forward. And I think it's helpful that we are still with them after the process. We don't assess, give them results, and then say goodbye. I think the relationship aspect is huge in giving these results. And then coming up and strategizing and giving them confidence and helping them to note areas where extra support can be provided. So almost deciphering and decoding the bad results into strategy, I think, is a really helpful way of providing this feedback.
Yeah. Elizabeth, if
Modupi,
I
do you
can
have
come
anything to
in.
add there?
Yes, no, I think because I think for start, we also need to acknowledge that our approach has always been a developmental approach. And that is why we have our change agents who are working directly with the ECD centers. And they have gained trust, they've gained, respect in the communities and the centers that they are supporting. So it makes it easy, or it's not much of a challenge to communicate, results that are not, desirable. But through the ECD center practitioners, the relationship that they have with the page agents, and also that we're taking an approach that is more developmental. And if they come in and say, "We'd want to work with you, how can we support you?" It's not necessarily, to say you're not doing well and pinpointing, but to say, how do we resolve this together and support you? I think that is the approach that we undertake.
Thank you, Modupi. Liesel has got a question for both of you. Liesel, would you like to unmute yourself?
Hi everyone. I had a quick question regarding your assessors. Were all your assessors in-house? And if any, what challenges, if there were in fact any, what challenges did you experience in just setting up and preparing for the whole for the field work and data collection?
We've had both cases. When we first started, we had outhouse assessors, so we contacted assessors. Challenges of that is that they're not always local, so there's arranging travel, arranging accommodation, and then also if the children are absent, extending the field work. So that was quite challenging with that scenario. But currently, as the time has gone on, we've invested. So we had 2 assessors, then we trained another 2 assessors. So currently all our assessors are in-house, but we make very sure to swap creches. So our trainers, who are also assessors, will not assess children that they have been involved in. So just to make sure that the results are valid and reliable. So we will always make sure that they are assessing children that they don't know or haven't encountered in the program.
And with us as well, yeah, we make use of external assessors for conducting the ELOM. They are in the province, so it's easier to reach to us. But then obviously the logistics of managing the accommodation and the transport, as I've mentioned earlier, that in most cases that the challenge is the remote communities where they need to reach to. So we'll have to find ways of how we support them to get to those centers. But it's something that is managed from that, from our side as well, to make sure that we make it easy for the assessment to be conducted.
Thank you.
Yes, Jessica's got another question actually there to both teams, and I think a little bit you kind of started answering that Singakwenza team, but to both of you. Oh, Jessica, ask your question, not me.
You can ask it too, Liz. It's a burning question, I think, all the time for everyone at Data Drive. But particularly, you're both quite particularly experienced in ELOM assessment. So presumably you do come and develop these lessons over time, the more you use it. So I'd love for you to share, what those kinds of lessons are each time you've done new assessments and how you've gone about things differently.
Modupi, do you want to start this time?
Yeah, sure, I would. Yeah, I think, Jessica, if I may just respond to you. Yes, what as I've mentioned earlier, that we have been in the past doing a lot of deep studies, but it's only last year that we undertook a major study in terms of the pre and post. So what we will do, anyway, and that's something that we sort of, it's embedded in our proposals, in our approach, where we have put ELOM as a tool that we're going to use in terms of continuously measuring the support for children. So it's something that we want to to sort of carry forward. It's not something that we would have done the pre and post last year only, but it's something that now, because it's embedded in our intervention, that we would include the pre and post as part of our support, and also speaks to our our monitoring and evaluation in terms of that. But I think more than what we want to do is to use the results for advocacy purposes, where we would want to gain more support in terms of early childhood development. And as I've mentioned, we speaking to the local government, bring it closer to the local government. We would want to use the results to advocate for support for children in the ECD centers, but also for ECD centers to provide quality, to ensure that there is quality services for young children in the communities. Thanks.
Thanks, Modupi. I think you've covered some of what we were going to say as well. So yeah, just to echo what Modupi is saying, it is very much about checking to see what it is that we are offering. Is it as holistic as we would like it to be? So that was a really big thing for us. And as Jade mentioned earlier in our presentation, we are, because we work with a community practitioner or community creche for a period of 2 years and then move on, that's built into our process. We are constantly changing the areas that we're working in and then different practitioners that we're working with. And because we're working with a slightly different group of practitioners, they're a different quintile, because one of our creches that we've included in the assessment for this year is in the Ladysmith area, and another one that's in the North Coast area, and we're based in Pietermaritzburg. So we can only travel to them every second week. So they're getting a dosage that is slightly less. So they get every second week for 3 years as opposed to every week for 2 years. So for us to see whether there is a difference from that perspective in the results of the evaluation of the program as well. Is there anything you want to add from that?
Thank you both. There's a sudden flood of questions because everyone realizes there are 5 minutes left. Jill, over to you. Would you like to unmute yourself?
Hello, thank you. Me again. Okay, I'm just wondering that you work with the practitioners. Now, are you giving the practitioners a set program to work with, or are they tweaking, how are you working with the practitioners? I love the mentoring, I love the support, it's vital, we know that. So is it a program, do you go in, train the practitioners in a specific program, and do they follow the program methodology in A, B, C, D, or 1 to 10? Or are they trained to look at the children in terms of VMI and other developmental areas, and then meet the needs of the children once they've assessed the children themselves? Because I just know when I was teaching, we included children with severe learning disabilities as a test in my class. And as a teacher, I needed to work out individualized programs for the children. So that's all I'm. Thank you.
Thank you, Jill. It's a great question. Because we are working in community creches with not necessarily trained practitioners, it would be absolutely ideal to get them to a stage where they were looking at each individual child and trying to focus on that. But what we found the most successful is our program actually is skills-based. So we focus the entire program. So every week when our trainer goes in and works with the practitioner, she brings in an activity that is focusing on gross motor, an activity focusing on fine motor, and activity focusing on VMI. So our actual program that we are running is all play-based, but it's specifically focusing on skills. So what we are training our practitioners to do is to identify the children who are lacking in certain skills. So if they notice that a child is really struggling to cut, what are some of the activities that they can do that are going to improve their ability to cut? So which are the ones that we need to do more of with those children? So that's part of our training process. That's part of what our trainers are doing when they're in the crate. So our trainers go in for a full day, 1 day a week, every week for 2 years. So they are with that practitioner, walking alongside her in the program, and they are also helping her to identify children who are exhibiting weaknesses or problems. I'm just going to get Jade to chat a little bit more. So obviously with the occupational therapy side, she is helping with those children who've got particular barriers to learning. So Jade, do you want to just take over here?
So we do train our practitioners in something called red flags, which helps them to identify developmental delays and barriers. And then we work with the practitioner on how to accommodate those needs in the classroom. And that will cover participating in the actual program. Like Julie said, if they have struggling in certain areas, then we will provide adaptive support, and then we also provide referral pathways if needed. So our creches are not equipped, some of them are, but not equipped for that, in your case scenario, severe learning disabilities. But some of our creches are open to having children with special needs, and then we work hand in hand with them to create where possible.
Thank you both. Sorry to be rude and interrupt. Fiona Burt has got a really interesting question. Fiona, do you have 1 minute to ask your question? I know we need to wrap up, but still it's a fascinating question. Over to you.
Thanks, Liz. Thanks for both the presentations, really, really helpful and interesting. So, and building off Jill's question in a way, I'm interested, I suppose, from both a moral and an academic point of view. So an academic design for an assessment of a program, for instance, would be that you test at baseline, you continue doing the program, you test at endline. But I'm thinking about the moral thing of making sure that if you know that there are some issues, and you've described very carefully how you approach it when you have the results of the baseline and the way that you're supporting practitioners in both programs. But so it would make sense from a moral point of view that if you know that things aren't going so well, that it's with the next group, particularly of children, that you would ensure that you make revisions and adaptations that make sure that you're going to get the best possible support to them. However, is that kind of, again, going back to sort of the academic question, is that a problem? Because that means that you're not actually delivering the program as it was designed. You're constantly updating it. And to be really, really cynical, you could say, I mean, that could be about gaming the system as well, that, trying to, learn, you could say it's learning from the baseline to kind of ensure that the end line is better. So it's just really about that.
Thank you, Fiona. Anything in the last 30 seconds you want to say about that, both of you?
Yes, Modupi, I don't know if you want to jump in here, but I just out of interest, Fiona, our baseline and our end line all results came out at the end of the year. So we didn't influence the program because of the baseline results. So next year, this coming year, Data Drive is going to make our baseline results available to us, which will show us where the weaknesses in the program are, which will allow us to adapt the program. But obviously with the results of last year's thing, we've already started adapting certain things that we've found we would like to improve on. So yes, you're right, it is manipulating the system, but in a positive way. So it's making us be able to provide a better program for all of our children. I hope that answers the question.
Thank you very much, Julie, and everyone. And Modupi, I'm going to cut everyone short here, but yes, it boils down to the fact this is research, but it's also where the rubber hits the road, and the in between area there is where we operate, actually, where we all operate. So thank you all so much for participating. I just wanted to close off by saying that you must look out for the next ELOM in Practice webinar at the end of April. We're going to be focusing on experiences of users who've never used the ELOM tools. They're using it for the first time. I'm sure a lot of you remember those hiccups along the way. Rumbi is going to be facilitating that, which will be very excited, and details will follow. And then just one final reminder about the Google form. If you could encourage you to provide feedback, because we always love feedback. But it has been a fascinating hour. Thank you so much to our dear presenters. Thank you so much for our participants. It's really grateful. We're very grateful, and have a happy rest of your Wednesday.
Thank you so much.
Thank you,
Keep well.
everybody.
Bye.
Bye-bye.
Bye.